Hi, I'm Nancy Allen. I serve as the Executive Director for the National Consortium for Health Science Education. We're happy to be here. We're happy that Paxton Patterson pulled together this opportunity for professional development in this virtual world as a way of getting out some great information to you. We are also looking forward to sharing a little bit about how our organization may be able to support you and the health science teachers across our nation. We were asked by Marianne Bland, who is helping to pull this opportunity together, to share a little bit about the future for healthcare and the need for workers. And I just wanted to touch a little bit on what happened in the early days of this pandemic. And you may have heard about it. You may have had family or friends that were affected by it, but you'll recall in late February and early March, because just the unknowns associated with this disease, that many operating suites across the nation were closed down. So elective surgeries, even some surgeries didn't feel like elective for patients, were all put on hold. And so with that, many people were downsized, some people were furloughed, even pharmacists, registered nurses, lab professionals, radiology, technologists, all across the board. Healthcare was affected by this shutdown, and then we were keeping beds open because we didn't know how many would need beds with the COVID-19 impact. We are pleased to say that with operating rooms opening back up in May in many places, that we know that people have been called back to work, and there's been stabilization of all that. And so for that, as a health professional myself, we're very, very pleased and happy to report that healthcare remains one of the largest sectors of our American economy. And it looks like it's going to stay strong over the next 10 years. You can see the average salary there for healthcare workers, a little over $53,000 a year. We're going to need more health professionals all the way for the next 10 years. Looks like we'll need 4 million more healthcare workers according to this data. And then some of the highest growing professions you'll see listed there: occupational therapy, home health aide, PAs, speech pathologists, and physical therapy assistants. So that may be for you who have an opportunity to provide career guidance to students. That may be something that you'd like to think about, where they may be able to get jobs in the future. We appreciate one of our partners, Chimera, who is they're in the business of forecasting the economy and also labor market data to help you have better communities. So if you're not familiar with Chimera, you'll see their name there in the on the slide. I invite you to visit their website. Really a really great partner for the consortium, and they will be doing a webinar for us on October the 14th about the economy and how it's affected healthcare. So at the end, I'll show you our website, and we invite you to join that webinar if that sounds like something that would be of interest to you. One of our other partners and a member of the National Health Science Consortium is NHA, formerly or sometimes known as the National Health Career Association, and they provide credentials. Many of those are available to our high school students. You are aware that most health professions do require training beyond high school, so a certificate program, a 2 or 4 year college degree, and even beyond that. But we are fortunate that there are some credentials that our students can receive right out of high school. There they are listed there. You'll see really the two most popular ones being nursing assisting and medical assisting. And there are some great skills within those programs that are transferable to many health professions. So as a former health science teacher myself, I remember students would say, but I'm going to medical school. Okay, you might be, and I hope you do, but you're still going to have to touch a patient. And so we would, go through the nursing assisting program as a part of our health science education program, and they would gain some valuable skills that were that would support them through their health science pathway. Just want you to be aware of these. NHA is certainly not the only provider of these credentials, but they did have this slide that sort of gave you a look at the popularity of some of these credentials available to high school students, and just wanted to share that with you if as you're thinking about the directions for your programs. The National Consortium for Health Science Education has been around since 1991, and it was formed as a way of supporting health science education with a consistent framework. So one of the first tasks of this collaborative was to create the National Health Science Standards, and they serve as a framework for schools, for teachers, for states to define what they're going to teach, not down to the course name and the course title, but these are broad, foundational, industry recognized standards for which we hope teachers and schools are able to use to develop their curriculums. We are going to look just briefly at 6 areas of support, and I've just mentioned one, the National Health Science Standards, and a way of confirming your health science curriculum. They were created in 1995, but they've been refreshed and refined to stay current with today's health industry. And we really believe that this is a wonderful framework for which you can align what is taught in your programs, whether it be at the middle school or the high school. Essential knowledge and skills needed by transferable to many health professionals, not specific down to sports medicine or nursing assisting, but broad foundational standards that are of value across the board to health professionals. It gives students a clear direction of what they're going to be learning. Teachers then understand what needs to be taught, and then from there they are able to design their curriculum and decide which assessments or which certifications are appropriate for their students. We do have a template on our website, because sometimes teachers will say, well, I don't know if I'm teaching the national standards or not. And then we'll say, well, look at your courses and then use this template, and you can kind of fit in there and see that over the course of whether you have your students for 3 courses, 4 courses, making sure that you are including all of the standards. We do have some, we do hear from some teachers and some states to say, I don't know exactly when to teach the standards, what's appropriate to teach where. And so we did, recently we created a framework or an example of when the standards could be taught. And so we grouped them together in a 4-course sequence that gives teachers maybe some ideas about what to teach for an intro to health science or a health science 1 course, all the way through the more advanced anatomy and physiology standards. Let me go back. Okay, so we do have some suggestions for classroom resources. And most recently, we released our health science curriculum enhancements. They don't replace the good work that our publishers and educational resource providers, partners have out there for our teachers. But this resource has been developed by teachers, for teachers, and it gives teachers many different strategies for delivering the National Health Science Standards. We contracted with a couple of teachers to create or refresh and redesign this resource. It's been around for about 8 years, but it really needed the infusion of some technology, and especially when we started this project, we realized that teachers really needed some great strategies for teaching online or in a blended environment or face-to-face. So this resource came out in August. If you want to know more about that, there's a webinar that's right on our homepage at healthscienceconsortium.org. And so the teachers are highlighting what's in this resource and how it can be valuable to the classroom teacher. It's completely online product, and the pricing is there at our online store. We do produce newsletters for health science educators, and we have a database of about 5,000 educators that we push this out to on a monthly basis. There's great little classroom tips in there, activities, and we call that the health science educator. Just another way that we want to be supportive of the classroom. As a part of our collaborative, we also welcome publishers and educational resource partners into our membership category. And we have about 22 members in this membership category. They're competitive. A lot of them produce similar products, but they all are interested in hearing what the health science classroom needs. And so we are very proud of this relationship that we have with this group, and how they really have worked to include the National Health Science Standards in their products and resources, and then how they will look to us to ask, what do the teachers need, what new courses might be introduced, and then they're able to provide the accompanying equipment or supplies or textbooks or online curriculum to support the success of the health science teacher. Also, there's a list of those folks on our website who are a part of the National Health Science Consortium, along with their national contact person. So for Paxton Patterson, we work closely with Bud Johnson, and just wanted to throw that in for them. But also we have contact information for all of our publishers and educational resource partners. So that might be helpful if your teachers or you or administrators are looking to hear more about a product or resource that has been developed by our partners. We also know that at the end of a health science program, there's a need to validate the learning. And so we have a certificate program. We have an end of program certificate called the National Health Science Certificate, as well as we have stackable credentials. Some teachers want their students to test throughout their health science journey through high school. And so we know that through Perkins, you do need to have certifications tied to your health science programs. They help inform instruction. The certificate program that we offer gives back data to the teachers down to the standard level, how your students did on teamwork, how your students did on academic foundation, legal, ethics, employability skills, safety, communication. So it's a great way for teachers to really improve their delivery of their curriculum, and provides accountability for both the teacher and the student. We partner with UScience, formerly known as Precision Exams, to deliver our certificates, and they're all listed on their website, uscience.com, and they're on the National Consortium website as well. End of course or end of program. Many of you have heard of HOSA, Future Health Professionals, and we have a strong partnership with them, as we believe that this curricular student organization really supports the learning of the health science students. They have a very comprehensive national competitive events program, and what we do each year is we look at their competitive events, and I think they have over 60 competitive events. And we look at the National Health Science Standards, and we do a crosswalk, because teachers like to know, when can I use these competitive events to reinforce the, what I'm teaching in the classroom. So this is on our website. It's also on the National HOSA website, a crosswalk to their competitive events to the National Health Science Standards. Just another resource and a way of supporting what's happening in the health science classroom. Another way of support is building professional learning networks and also partnerships. I've talked a little bit about our partnerships with our educational resource providers and publishers. We offer the Health Science Educators Association, and this is the teacher arm of our national organization. We launched this teacher association about 2 years ago. We are not in competition with ACTE and their Health Science Education Division. We know that they do great work, especially on the policy side and the advocacy side. We are more on the resource and support at the classroom level. And since this organization was formed in the summer of 2018, we are now approaching 500 members. We are having some states bringing whole groups of health science teachers on to be a part of this association. It's a $45 per year individual membership fee, and they get access to exclusive free classroom resources. So they get put into a Google Drive, of which we have populated and pulled together lots of lesson plans, PowerPoints, activities, projects that have been created by health science teachers. And we have them there and available to those who become members of the Health Science Educators Association. They have a free Facebook group where there's a lot of exchange and interaction between teachers, asking for this, asking for suggestions. It is extremely encouraging to us to see the type of conversations that we had envisioned this organization would be able to provide, so that it brings the nation closer together and really maybe saves time for teachers, borrowing from other teachers, and really support for those new teachers who have come from industry and may really not have the background of being successful in the classroom. We know that as health science educators and those administrators who support these programs, that guidance is really our best friend and really the gatekeeper of who comes in to the health science program. So find a way to be friends with guidance, also to get to know your community, your healthcare industry within your community. Let them know about your program. Many have no idea what goes on at the high school level in a comprehensive high school or in a career and technology education center. So I just can't encourage you enough about making friends with the community. Invite them to be a part of your advisory council. Bring your students in front of them when that is possible one day in the future, we hope. And maybe these people will even become your work-based learning partners. We know that there's a big competition for work-based learning opportunities for our students, just because there's a high demand for those experiences, and maybe those secondary programs are not the highest priority for them, but lean on them and encourage them to grow their own. And you never know, a good work-based learning experience that one of our students could have in a hospital, in a long-term care facility, in a pharmacy, in an outpatient clinic, they could become their next employees. We see as one of our strategic priorities is to provide professional development for our teachers. And we started this Wednesday webinars in January of 2020, and they have been extremely popular. They're free. You can go on our website under the events tab. We offer Wednesday webinars at 4 p.m. Eastern Time, 2 to 4 times a month. Sometimes they're provided by teachers, sometimes they're provided by partners, and just great information for teachers or administrators, all kind of focused around health science education. We also provide a certificate of participation. Some teachers are interested in that, documenting their professional development experiences. And so if they come and they're able to attend live, but we do record those and archive them on our website under the webinars tab. We annually offer the National Health Science Conference, and we had hoped to be in Charleston, South Carolina this year, but as you know, face-to-face became a thing of the past for now. And so our conference will be virtual this year, just like many conferences across the nation. So we offer this conference in an affordable, a flexible format. We realized that teachers were likely not going to be able to get substitutes to attend a virtual conference. And so when we made the decision to flip this from face-to-face to virtual, we decided that we needed for it to be very flexible. So the live content will be Tuesday through Friday, October the 27th through the 30th, and it will be 5 p.m. to 7 p.m. Eastern time. And if teachers cannot come, it will be pushed to live on demand, so they can. It'll be for those who paid to attend. They will still have access to it. Then on Halloween, on Saturday the 31st, we'll just have a 1-hour closing party with door prizes and games, and just a way to celebrate health science educators. We made it extremely affordable. The registration fee is $200. It was $175 through October 1st, and now it's $200, but the content will be available for 30 days from the beginning of the conference. So we'll have the 9 hours of live content, and then we have about 50 breakout sessions that are around 45 minutes each. And all those will be available for 30 days, as I said. They can watch them at their leisure. They can pick and choose the ones, that are very relevant and speak to them. And we just encourage you to consider coming to the conference, and then keeping our fingers crossed that in 2021, we'll be able to replicate this wonderful event, this highly engaging health science education professional opportunity. Will be in Cincinnati, Ohio in 2021, and in 2022 we'll be back in Charleston, South Carolina. So all this information is on our website as well. Just consider leaning on us, the National Authority for Health Science Education. We are here to do what we can to support health science education through the standards, through professional development, through our teacher organization, through the collaborative we provide for health science state leaders across the nation, and through our partnerships with educational resource providers. There's my contact information, Nancy at healthscienceconsortium.org, and there's our website, healthscienceconsortium.org, very similar to my website. We would love to come to your conferences, provide professional development for your teachers. There are member discounts for teachers who are a member of the Health Science Educators Association, or teachers whose state or their state education agency are members of the consortium. We appreciate Paxton Patterson having us. We look forward to hearing from you. If you'd like to get our newsletter, if you'd like to come to our webinars, they're free, they're open, they're on our website. And maybe it looks like I have just a couple of minutes here. I was going to go to our website and show you where a couple of these things are. So here under events, you'll get all the information. Let me close this. Okay. So under events, there's all the information about our conference and we'll have a list of all the workshops, and the description will be there the first week in October. If you click on events, this is where you'll find a listing for all the websites, and where you can, if you click on learn more, you can register for those. And we talked about our certificates or our assessments, the National Health Science Standards. We talked about those and how we believe they can provide a framework for consistency for your programs. And so you can access the standards here. And if that's completely new news for you, then we invite you to see how your program might be aligned to the National Health Science Standards. Let me just go back out of here one more time to our home page. healthscienceconsortium.org, and remember, my email is nancy@healthscienceconsortium.org. Here's in closing, this is the information about the health science curriculum enhancements that I mentioned that we developed to support teachers that are in the virtual setting, face-to-face or blended, and lots of outlines, PowerPoints, activities, projects, videos, test items with lots of technology. So if you're interested in that, you can watch the webinar. I appreciate what you do for health science students. I appreciate you helping us prepare that next generation of health professionals. We know that they're going to get jobs. We know they're going to be high wage, high demand jobs. And we just thank you for what you do for CTE and especially for health science.